Recording in progress.
Great. So we're going to record today. We record Homeless and Housing Task Force as part of our sort of like commitment to make it all very accessible, public information. When we are done recording, and in a day or two, we will post it on the HSC website in the Homeless and Housing Task Force tab. I will post a link. That's also where the link for this meeting will always live. And that is just an easy way to find the link for the meeting, this meeting, which is always going to happen on the first Wednesday of even numbered months. And I'll send out reminders about it, but those things are always on that place in the website. So if you missed a meeting in the past and you want to go back and see what people were talking about, that's a great way to find information. Also, if you're like, where is the link for this meeting? That is where it will always live, although I'm happy to send it to you again. Thank you all for doing introductions. I think it's really important to have names and faces and a sense of who's doing what and where, and get to know each other a little bit, sort of constantly. So I appreciate you all humoring me. The beginning of the meeting today, we do have time for some updates from people who are working in the homeless response system specifically. So doing any kind of emergency shelter services, basic needs, prevention or rental assistance resources, permanent supportive housing, all the homeless response system specific and updates we look for first. Is there anyone in that sector who has an announcement that they want to share this morning?
Liddy, this is Marty. I can do an update since everybody knows it's cold weather is going to be, Code Blue is going to be ending soon, maybe not quite as soon. Who knows? Because it could be 15 or it could be 60 anytime in April. Processes are the same as, as they have been the previous years. There's lots of information that has gone out to everybody, encouraging people to sign up for THA. I think what I really wanted to give an update, and it's not like the best update, is what our resources are for rental assistance, and they're few and far between at this point. It's a new year for our rental supplement program, which has been going very well. Unfortunately, all the money is allocated to people who are in housing now. So there is not new funding. STEP funding for rapid rehousing is in the same situation. All the money has been allocated to people who are in housing, and so we wait for the next round of funding, which doesn't come till October. We've made our funders very aware of the fact that we have used up the money months before, so that if there is any additional money from perhaps other counties that could be allocated, we want to let them know that we're glad to accept it. And even the family unification program through IHA that applications go through DSS, that has a long waiting list at this point, and that unfortunately has been one of our better sources of getting people into housing, into permanently funded housing quickly. But that waiting list is a lot longer than it has been as of late. So we eagerly wait for the openings in the new Ishai program, because that seems like that's kind of the best path for the folks, at least, who are in the shelter and totally homeless right now. So not a very encouraging update.
Thanks, Marty. Your update matched the weather, maybe.
Yes, it's kind of wet. It matches the smell of wet dog in my house at the moment.
It sets the scene. Thank you. I appreciate it. Next I have Leslie and then Mira.
So my update has to do with the Housing for School Success program. Ithaca City School District discontinued that, and I believe it's effective April 17, and they sent out a letter about 3 weeks notice. There's nothing in the letter about any plans to recreate it in any other way, shape, or form, but it will no longer exist.
Thank you for your update, Leslie. Another chipper update.
I am pleased.
Thank you. I don't mean to be sarcastic, that there's a lot of changes happening in our system, for sure. Mira.
Hey everyone, I have a slightly more positive update, and that's that I get to announce Tompkins County's new mobility program, Making Moves. So I've joined TC Action as the program manager for Making Moves, and I will share my email in the chat. Please reach out to me if you have questions. I can share programming information. I'm happy to chat, meet with everyone. But the program is specifically open to families who have housing choice vouchers, whether it's with TC Action or IHA. And if they have a housing choice voucher and at least one child under the age of 18 living with them. And we offer housing mobility support, everything from there's financial support available for folks who meet certain criteria, but I'm open to helping anyone just with that housing search. So especially anyone who is at imminent risk of losing their housing with a voucher, or is a new voucher holder and struggling to find housing, please just send everyone my way. I'm really excited to be starting this program and working with all of you. So I will share my email and I hope to talk with all of you.
Awesome, Mira. Thank you. Yeah, we're super excited to see this program get going. It's cool. Anissa.
Hi, everyone. I just wanted to remind people that I'm in the midst of creating the 5-year strategy for use of the city's HUD entitlement funds. It's called the Consolidated Plan, or CON Plan, in case you see that in correspondence. The HUD entitlement funds can be used for affordable housing and other community needs. I include information that I learn at meetings like this and from talking to all of you in the community. But I just want to let everybody know I'm going to put my email in the chat, because if I haven't reached out to you lately, or you have something you want me to know about, or you want to make sure that the needs of those that you serve are definitely articulated in the plan, please, please, please reach out to me. I really do want to hear from you, ideally before April 20th. Thanks so much.
Thanks, Anissa. Tim. Oh, no.
Hi, lady. Yeah,
Oh, yeah.
I just wanted to give a quick update on SOS. I don't know how many people know what the SOS is on this call, but the Safe Option Support Award that OMH put out earlier this year, we got awarded last year, but it started January. But the street outreach program that covers Portland, Tompkins, Tioga County. So we were awarded that grant to perform these activities across those 3 counties. So Amanda was on the call. I think she still is on here. So we were able to hire our team leader to try to get this project up and running. So that was our first step. We're starting to staff up with case manager to try to get some people, on the ground and working towards, providing true street outreach across those 3 counties. So Amanda will be probably connecting with many people on this call and other people that are referred to her for coordination of activities. Our goal is to enhance the street outreach that is already happening in Tompkins and Tioga County, and provide more support through this program and try to get people housed. That's the whole goal. So there's a lot of coordination, I think, that still needs to happen. But at least we have the person that can start making that happen. So you'll probably be hearing from Amanda individually. She'll be attending these meetings. And we're partnering with Eric and his organization RSS to provide coverage for the 3-county area. So more to come, but the first step was getting someone hired to run the program, and we got that. So I'm happy about that, and we can start moving forward. That's it. Thanks.
Thanks. Great. Look how much we all just learned about stuff. There's a lot going on. Thank you all. So our first presenters today are Charlie Willison and Paula Ianniti. They're here to talk to us about sunflower houses and a recent report that they have just done assessing the project in the first couple of years. I had the opportunity to see a similar presentation at for the county, and I thought, ooh, I think that the full Homeless and Housing Task Force would be awfully interested in this. So I'm glad that they were able to join us and give this presentation. Without any further ado, you all can take it away. You should be able to share your screen and all things.
Thanks so much, Liddy. I am going to share my screen so that you can hopefully see this. All right. There's a lot of thank yous to give ahead of time. First and foremost, I want to just say that this report and all the research activities that you see over the past 2 years have been made possible by a number of community partners. First of all, it was commissioned by URO, by Ultimate Reentry Opportunity Initiative, Tali Mugambi. And URO, of course, is funded by the Park Foundation, which makes it possible for them to operate and to partner with researchers like myself and Charlie Willison, as well as many other researchers along the way over many years. Similarly, I want to thank the county, Tompkins County, for essentially funding a 3-year assessment of the sunflower houses. So when we put forward the proposal to fund the sunflower houses to the county back in 2020, we also pitched that we would love to actually evaluate its effectiveness, and they graciously funded that process, which has enabled a lot of quantitative and qualitative analyses that otherwise would not have been possible. So thank you to the county, and I'm looking at Martha, who at that time was part of this work, as well as many of you as community stakeholders. I also want to say that this is in many ways, the sunflower houses themselves as a project are a collective impact outcome that really began in 2017. So I want to say this to this group in particular, because many of you know how long it takes to actually make even a small project like the sunflower houses come to reality and then to become sustainable. And I put in the chat a report from 2020, the research of which actually began in 2018 with a couple of partners from Cornell University, where we qualitatively assessed systemic barriers to reentry for people in Tompkins County. So we interviewed 56 formerly incarcerated people in the county, very racially diverse, as well as gender diversity. And what they basically said to us over and over again is that their primary challenge was the inability to find affordable housing. And their main options were, of course, coming out of jails and prisons, was to go to the homeless shelter and or kind of receive a DSS housing voucher for usually $380 to $400, where they could very rarely find a room to rent somewhere that was centrally located. So the collective impact model that URO works with is really looking at the ways in which everything intersects, so that if you don't have housing that's centrally located, you also can't access employment. If you can't access centrally located social services, it's very unlikely that you'll be able to access health services that are really necessary for this population. And similarly, we found in the respective qualitative themes that emerged out of on the themes of housing, transportation, health, and employment, that almost everything revolved at the center of it with to this question of not being able to be centrally located, affordable housing from which people could access not only services, but employment, health services, and so on. So out of that study came a housing summit that took place in 2020. Many of you who are on this call were at that housing summit that URO conducted. And similarly, that housing summit brought together a number of community stakeholders, such as yourselves, who worked in the kind of housing landscape of Tompkins County. There were also city council people, Tompkins County legislators, but basically that group came together alongside formerly incarcerated people to set priorities for URO's initiatives. And it is out of that essentially the sunflower houses were born. So it's a long history. We're gonna not go into all of that, but in 2021, the sunflower houses began being operated by OAR, Opportunities, Alternatives, and Resources. Haley, who's on this call, was actually its first housing manager, and Dave Sanders essentially took over at that time as executive director. But very importantly, it was a partnership between INHS, Ithaca Neighborhood Housing Services, who for the first time had some housing units that were not restricted by some of its grant funding, and was able to essentially give them to OAR to operate. So this is another really important piece, that they were centrally located, that they were unencumbered by other kinds of restrictions. And that allowed this population, who often has not only DSS sanctions or barriers for obtaining housing, but often sits at that intersection of houselessness, substance use disorders, mental health conditions, chronic illness, disability, and formerly incarcerated criminal records, which basically means that they often can't access a lot of the other housing options in the county, or they're not in the priority populations of essentially supportive housing or Section 8 kind of vouchers, because they are not necessarily in those prioritized populations. So the sunflower houses was born out of that, and we are now at this report is basically an assessment of its first 2 years. So that's really important. We'll put another report out at the end of this year that includes qualitative interviews with sunflower houses residents, as well as people who have since moved out. And that qualitative report will sort of embellish this one, which focuses on some of the quantitative measures that the program assessed. So, okay, that was the background. Now I'm going to actually go into it. And I want to thank especially Charlie Willison, who is my co-presenter today, who came off the hill from Cornell University and fiercely partnered with us in making this research possible through a bunch of funding from Cornell and her own research funds to make this a full assessment. So really, I want to just in this assessment overview, the initial funding from the county was for a 3-year pilot for both the sunflower houses as well as the research to assess it. So we are now at that juncture, and many of you on this call will see this very soon if you're in the Human Services Coalition. We are in the process of essentially reporting on the effectiveness of the Sunflower Houses program, because we are looking to obtain permanent funding for it through OAR's permanent funding operational structure. And we'll talk a lot about that in just a moment. We're going to kind of give you an idea of what the theory of change of those of us who established the Sunflower Houses was, and what kind of lessons have we learned along the way. We'll go over some budgetary considerations, but importantly, we'll also walk you through some quantitative measures, specifically on what we were looking to do with the Sunflower Houses, which was not only to provide safe, affordable, centrally located housing with wraparound services for people who are at deep intersecting vulnerabilities in our county, but we were also looking to reduce the recidivism rate so as to not essentially have these folks cycle in and out of the local jail system. So these are the measures, the quantitative measures that the Sunflower Houses is going to look at. We'll walk through this in just a moment, but essentially we'll look not only at the Sunflower Houses, but also at OER clients who are similarly situated. In other words, OER works with a lot of folks who are either houseless or housing insecure, and they in some ways provide a good comparison. What is the difference between people who do have affordable housing with supportive services, wraparound services, versus those who are similarly situated but do not have that central, safe, affordable housing. And so this was essentially, we, to our knowledge, Sunflower Houses is the first housing first model program that was also set up through a restorative justice lens. And what we mean by that is that the majority of transitional housing historically is very punitive. And essentially people who are under parole, various forms of court supervision or probation, or even those who are no longer under state surveillance or supervision, but are at very high risk of recidivating. A lot of those folks, when they enter, when they come into transitional housing, they face things like curfews or drug tests or various other kinds of measures that then often cycles them back into prison or jail. So we decided that that is not the approach we wanted to take with the Sunflower Houses. And instead, we really worked to, of course, set up specific guidelines for what it means to be a resident in the program, but at the same time, truly try to take a customized, individualized approach to work with people to the best of our ability, to not kick them out and leave them houseless, but to try to work even when they're not abiding by housing program rules, to find them alternative housing options, and of course, to the best of our ability to work with them so that they're not facing those kind of a repetitive cycle of punitive measures. And what we were really looking to do is our theory of change was that providing centrally located safe, affordable housing with supportive services by OER would reduce the recidivism rates for this population and foster higher success outcomes. And the key outcomes we were looking at are housing, employment, health access, and services and transportation for people in reentry. Let me now talk a little bit about the budget aspects of this. And I will not, I'm not going to sugarcoat this, because one of the core wrong assumptions we made when we set up the Sunflower Houses is we thought that people who would normally be eligible for DSS's total needs emergency grant, that $400 that you can get to sort of get a room somewhere if somebody's willing to rent at that rate. We made the assumption that the majority of the folks we were trying to house in the program would have access to that voucher. And out of that is how we budgeted what we thought it would cost to run the Sunflower Houses. We were assuming that those folks would be able to pay $380 to $400 per room. There's 4 units, 12 rooms in the Sunflower Houses. So that was, we thought we would have rental income coming a lot more in this partnership with DSS. Turns out that was a really bad assumption to make. And the reason it was a bad assumption is because many of our folks have DSS sanctions that prohibits them from getting that housing voucher, or they had been so kind of in the labyrinth of various regulations, so unable to access other kinds of housing assistance grants that essentially they had no rental income to contribute to the program. So in year 1, that left OER at a massive deficit. The other thing we underestimated is the cost of utilities for the 2 the 4-bedroom units. And one of the things that I'll just mention here is that there are utility assistance programs for low-income people, but they require that you have an individualized meter for each person. And because of our units are set up in 3-bedroom units that are shared, this was not something that OER could qualify those units for. So that left them with a lot of utility costs that couldn't be offset by various utility assistance types of programs available in the county. And as you see here, the program was in danger of shutting down because it was at basically forcing OAR to run at against its own reserves at a negative approximately $93,000. In 2023, fortunately, thankfully to the innovation of Dave Sanders, there was a NISHIP grant that Dave was able to obtain to offset some of those costs, but you can see that operationally the housing program was still running at a deficit. And the main reason for that, and I'll talk about this in just a minute, is the inability of these folks to actually pay rent in the way that we had thought that they would be able to essentially start contributing over time. And a lot of this has to do with this population's chronic illness conditions, which prevents them from working, even with the supportive housing, as well as folks who are sitting at the intersection of substance use disorders and mental health disorders, such that the health conditions of the residents makes it very difficult to subsidize the rent. Finally, because of some opioid settlement grants, as well as a continued NISHIP funding, you can see that in year 3, OER successfully offset some of those costs. But what we learned in the long story short here is that it's actually much more costly to run this program than we had originally projected. However, very important as well, we also learned that it's still significantly less costly to run this program and support these folks than it is to incarcerate them. If we were to do a more robust study to consider also emergency services for the county, such as hospitals and ambulance services and things like that, we would likely still think, that the program would be less costly overall than what it would otherwise be to not have this program. And here you can kind of see also the high needs that this population has, where OAR staff essentially calculated that 6 different staff members work for a combined total of 66 hours per week to meet the needs of Sunflower clients. And I'm going to kick it over to Charlie now to talk about how this kind of dovetails in the larger context of incarceration and recidivism in the county.
Thank you so much, Paula, and thank you so much for having us today. So as Paula mentioned, I'm just going to provide some background before we dig into Sunflower Houses and OAR for the context of incarceration trends and recidivism rates in the county, for then to be able to have context for us to compare with Sunflower and OAR. So first, I'm just going to talk about local incarceration trends pertaining to Tompkins County Jail census. This data comes from, or all of the data that I'll be talking about comes from the Tompkins County Sheriff's Report. So thank you very much to them for providing us with this data. So for this first chart that I'm going to discuss, you'll note, and I'm just going to move my video here so I can see the chart, that overall in Tompkins County, so this is looking from 2015 to 2023, we do see a decline in daily jail census, or sorry, this is annual jail census count. So we see a reduction, but then starting in 2021, we're kind of looking past 2020. Obviously, that was a highly unusual year. But so starting in 2021, even though we've seen this reduction over time since 2015, we do start to see an increase in annual jail census counts from 2021 to 2023. And 2021, importantly, was the year that Sunflower Houses began. And so between 2021 and 2023, we saw a 60% increase in annual jail census counts in Tompkins County. So moving on, so now I was just talking about annual trends, now moving on to discuss these average daily jail census counts. So you kind of see the same thing happening here. Again, same time period. This is from 2015 to 2023 for Tompkins County. Again, this data coming from the Sheriff's Report. And what we see here, again, I'll just point your attention to 2021, where even though we've seen this reduction, again, this chart looks pretty similar to the previous chart with the annual trends. In 2021, we do see again the average daily jail census counts starting to increase. And this was the year that Sunflower Houses began. And we also do see a comparable increase between 2021 and 2023 by almost 60% in those years. Again, very comparable to the annual census counts for the jail. So now we're going to flip a little bit and talk about what this means for the context of racial disparities, which is obviously a primary goal of Sunflower Houses, thinking about reducing incarceration and recidivism trends overall, but also thinking about this in the context of race and racism and racial disparities. So again, this is the same time period, 2015 to 2023. And this is looking at the Black-white racial disparity by year in this time period. And you'll see that this chart looks quite different from the previous two that I just showed you. The previous two, we did see some reductions between 2015 and 2020. This, however, you do see a kind of steady increase over time. And what I want to emphasize here is that if we look at the final year, in 2023, Black or African American people were over 8 times more likely than white people to be incarcerated in Tompkins County jail. So this is, we have a lot of progress that we need to make with regards to this measure, very importantly. So now this is a little bit different. So this is just looking at 2023, that last year that I mentioned. And so here we have a comparison point. This is between, to give us a better understanding of the context with the county overall compared to the population that is in jail. And you can see that looking at the proportion of county residents that are white compared to the proportion of county residents that are Black, we see a really significant disproportionality between the number of Black residents that are represented in the jail population compared to the proportion of white residents that are represented in the jail population. And so Black people in Tompkins County only make up about 4.6% of the county's population. Again, this is from 2023. However, they make up 31% of people who are incarcerated in Tompkins County. Now, switching gears just a little bit, I'm now going to talk about recidivism rates. And here this is looking at the rebooking recidivism rate specifically for unsentenced and committed. Again, same time period that I've been discussing, 2015 to 2023. And again, if we think back to the first two charts that I was discussing, we do see this kind of reduction at the beginning of the time period. But again, in the year that Sunflower Houses started in 2021, we see that the rebooking recidivism rate for unsentenced and committed people has also been increasing in the past 3 years, from about almost 20% in 2021 to just over 24% in 2023. So this is a smaller increase, but we are still seeing an increase in the recidivism rate. And then here, now this one is a little bit different. And this is a shorter time period because we wanted to get a better sense of what a true or more valid measure of recidivism looks like in the county. And this is because, so this is a shorter time period because, for example, someone might be rebooked, between December and January. So having this measure across a couple of years, we think is a more effective measure of what recidivism actually looks like in Tompkins County. And so this is from 2021 to 2023 for both committed and unsentenced and released on recognizance. And so this is for people who were booked 2 or more times between 2021 and 2023. And we find that the rebooking rate is almost 35%, which is quite substantial. You can also see that it's relatively consistent across demographic groups. But again, this is a significant proportion of people who are being rebooked.
Excuse me, Charlie, what does committed mean?
I will turn this over to Paula for that question. Thank
That
you.
means that they're actually detained in the jail pre-trial. So the difference between ROR, or released on recognizance, is you can be given a ticket to appear to court, right? But you're still booked in the jail, and then given that ticket. Whereas committed means you're actually sitting in jail, essentially awaiting your trial. Why that's important, the difference between so when you look kind of, oops, sorry, let me go back. When you look at this rate does not include those people who are released on their own recognizance, right? It just includes only those people that are awaiting trial and sitting in jail, as well as those who are essentially sentenced or are committed to the jail. So basically,
How can somebody recidivate if they're in jail?
so recidivism means that you got booked one time and then you got booked again. So essentially, it's the process of getting rebooked more than one time. Doesn't mean you actually get sentenced or that you're found guilty, if that makes sense. And the reason when we say rebooking, it just means that you've been rearrested and taken back to jail more than one time.
And
Does
this,
that
I'll
make
just
sense?
add, is obviously really important for this population, especially for people experiencing homelessness, people experiencing unsheltered homelessness, who we do know have much higher likelihood of these cycles of incarceration. And so this is one of the reasons why we're interested in this measure specifically.
So you're
Yeah.
looking at people who are in the jail and asking how many of them have been booked more than once,
More than once in a given year. Yeah.
or
So in this
how many
chart,
are there for the first time. Got it.
exactly. Yeah. In this chart in 2023, 24% had been already in the jail in 2023 one other time, at least one other time. Some people could be rebooked more than 2 times per year. And what this is telling us is that these people are cycling in and out, right? And each time they cycle in and out, it affects potentially their loss of housing, it affects their loss of employment, it affects interruption of services, right? So anyone who's in jail, for example, loses Medicaid because they're considered to be under supervision and not needing Medicaid. That then interrupts their Medicaid access. Even if they're released 2 weeks later, they still have now another 2 weeks before they'll get they'll be able to reactivate their Medicaid, which then means that they don't have access to certain services during that 2-week period. Does that make sense? So that's partially why we're so concerned with the rebooking, even if somebody isn't resentenced, right? Even if they're found not guilty, the process of getting rearrested and sitting in jail can have this huge impact on people. In this chart, we're looking at people who had been rebooked 2 or more times in that 2-year period. So it's a combined stat, which we think is more accurate. Yeah, if you're not in that lingo, feel free to ask additional questions on this. Let me now turn to the sunflower houses. And what we essentially did is, this is really important, is that one of the commitments the sunflower houses made from its inception was that it would have a racial equity lens in the way that the program was set up. And what that meant is that we were going to be very proactive in making sure that people of color who were overrepresented in the local incarceration system by over 40%, as you saw, that the sunflower houses essentially would serve those people at a similar rate. And so the program was successful in this regard. You can see that the breakdown of race for sunflower houses clients is 34% Black, 2.4% Latino or Hispanic, 2.4% biracial, and approximately 56%. So this basically has kind of an on par rate with the incarceration, with the people who are represented in the local incarceration rates. On the gender piece, it's really significant that there's very few resources for LGBTQ identified folks and transgender folks when it comes to housing options for those who are formerly incarcerated. We know from national data that LGBTQ folks of color are particularly vulnerable to having police contact, arrest, and rebooking. And so we made a commitment to not only be essentially inclusive of LGBTQ folks as well as trans folks, but also to have a unit set aside for women. And women who are incarcerated or cycling in out of the incarceration system often have a multiple kind of barriers in terms of being able to reunite with their children, but also have a difficult time finding specific housing options that give them the services that they need. So we are also proud of the fact that approximately almost 20% of our residents have been women, and approximately a certain percentage has also been trans or LGBTQ identified. I want to kind of just emphasize here, who are we talking about when we say Sunflower Houses residents? In 2013 alone, Sunflower clients spent a combined total of 117 days in treatment for substance use disorders, as well as 138 days hospitalized for chronic health issues and injuries. What we're talking about is a population that not only has experienced homelessness or housing insecurity multiple times throughout their lives. Often, many of them have start this experience through the foster care system, but that they also have significant health conditions, both from family trauma and early childhood trauma, but also essentially, very importantly, that the impact of incarceration itself has been shown to produce increased health risks and negative health outcomes. So what we're talking about here is a population that is often struggling at these intersections. And this was reflected in the significant health services and time that they spent in various kind of health conditions. 100% of Sunflower clients are formerly incarcerated, and 73.8% arrived to the program as being houseless or housing insecure. And 98% of them struggled in their own self-avowed disclosure at intake with substance use disorders while in the program. This is the significance of having a housing first model. It means we don't turn people away based on where they're at. It also means that they need significant assistance as they reside in the program to both access recovery services, health services, medically assisted treatments, and at times potential referrals to residential treatment programs, and then they can come back. But here you can kind of see the overlapping issues that affect this population in this diagram, the overlapping vulnerabilities as well as structural barriers that many Sunflower clients face. And this is that collective impact model that URO originally conceptualized this whole program through. It's the fact that you can't ignore these things as if they are dissociated. So even given that, all of those vulnerabilities, all of those systemic risks and barriers, we found that Sunflower clients, that their rebooking recidivism rate while residing in the program was 7%. So this is a pretty insignificant success measure. But what we mean by rebooking recidivism rate is that while they were living in the program, only 7% got rebooked into the Tompkins County Jail. In other words, more than once in that period that we're looking at from 2021 from 2023. Now, that tells you what the significance of providing these wraparound services and direct support services, why the case management piece matters so much. Because when we looked at Sunflower Houses program clients that had moved out and measured their recidivism rebooking rate after they left the program, we did see that it increased to 28%, suggesting that once they lose those wraparound services, as well as the stability of the housing, that many of them do end up back cycling. So clearly we need long-term solutions beyond the sunflower houses, which was never meant to be permanent housing with those kinds of support services, but we do need that. I also want to note, though, that the sample is very small in that we're only looking at 32 people. So we will need to measure this over a longer period of time to really get a closer look at what this looks like. Many of the sunflower clients used OER services quite a bit. We took only a sample from January to September 2022, just to see what kind of services are they using. Many of them had that close connection with OER. They would come to drop-in hours. Haley, who's on the call, would assist them with finding permanent housing and other kind of housing options. And you can see that many of them used OER to get employment assistance through workforce grants, transportation assistance like bus passes, and various kinds of referrals to other services, as well as obtaining IDs, getting driver's licenses, and so on. In terms of the core outcomes that we measured, I'm going to emphasize the housing piece here, which is that this is essentially the total number of people that have been in the sunflower houses at this point in time is a total of 42. 10 of those people are currently residing in the program, and so 32 have since moved out of the program since the program began. You see that 31 of them began as houseless, 73.8% began as homeless before they entered the program. When they exited the program, 26 had obtained permanent housing, 23.8 had obtained temporary housing, 7% went to residential rehabilitation programs. OER over time changed its process to hold their room while they were in a residential treatment program to be able to come back to the sunflower houses if the client asked for that. There were 7 that went back into homelessness, mainly the homeless shelter, and only 1 that passed away while after exiting the program. So why is this important? We find that while 73.8% of people were homeless when they entered the program, only 16.7 were homeless upon exiting the program. This represents a 57% decrease in homelessness. I know the total numbers are small, but again, we're piloting a program to see its effectiveness in reducing homelessness rates. And so it's been successful in that regard. And even with respect to clients who secured temporary housing after leaving the program, there was a 9.5% increase in people who had temporary housing. So on those 2 measures, the program is quite successful. And obviously with the kind of shoestring budget that it had, it did the best it could. Certainly there's probably improvements to be made. Many of these folks that ended up back in homelessness were people who were not following program rules. And so they were, for example, putting other people who are on probation and parole at risk by living in the program. And so they were asked to leave. Again, OER tries to assist them to find alternative housing options beyond the program when they leave. And then we'll just say a couple more things about OER clients here, and just as a kind of point of comparison. And this is the OER clients. When we looked at it, they had almost 1,200 clients. I do want to emphasize that OER has become an incredible hub for people who come for services who are working at these intersections of mental health, substance use, formerly incarcerated, chronic homelessness. And this is their demographic breakdown of who they serve. And this is the gender breakdown of who they serve. And we found, by way of comparison, that the rebooking recidivism rate for OER clients during that same period of 2021 to 2023 was about 17%. This is less than the county rate during that same period, but it is higher than the Sunflower Houses in program rate. And so what that suggests to us is that having access to safe, affordable housing does make a difference in the risk that you will get rebooked into the local jail. And then here you can kind of I'll caution you in looking at this graph that because the sample sizes and the method for calculating these rates are very different, you shouldn't necessarily compare these. It's kind of like comparing apples to oranges. But what I will say is that here you can see the countywide rate. The total sample size for that was 951 over this 21 to 23 rate. Here's what OER clients are at, 17.5%. Here's Sunflower Houses in program. And here's people who are not OER clients, but are also recidivating, right? So here you can see non-OER clients had a higher recidivism rate than OER clients, again, suggesting the significance of those wraparound services. And we'll conclude by just Charlie talking about some of the recommendations we made to the county, but I'll emphasize here that everybody on this call could assist us in advocating to the county to essentially fund the program with permanent funding, essentially incorporating it into OER's operating budget. But Charlie, take it away.
Yeah, thank you so much, Paula. So obviously the first big recommendation is to permanently fund OER personnel and expense costs in the amount of $170,000 per year, which if you remember back from the budget slide that Paula had, this is what that total cost was that they were almost able to meet. But again, due to these unexpected cost barriers, just couldn't quite get there. And I'll also just emphasize, as Paula said just a little bit ago, that it is quite fantastic that the program has been so successful on this shoestring budget. And so having secure long-term funding with the ability, to improve staffing and resources will likely make the program that much more successful. This next piece, OER has been really, really important in thinking about the distribution of funds for transitional housing to non-New York City regions. So we do obviously know that in state budgeting, a substantial proportion of funding goes to New York City. However, all of these issues obviously affect Tompkins County, but also in the surrounding regions. And so one piece that we think is really important for our local legislatures is to petition the New York State Assembly members and senators to add $7.8 million in transitional housing funding for these non-New York City regions. Again, especially thinking about the importance of homelessness and cycles of recidivism for these regions outside of New York City. Not surprisingly, the third recommendation is obviously to think about extending this model when we're thinking about the availability of supportive housing in Tompkins County. Again, through this low barrier housing first model, Sunflower Houses is a great model. It's temporary housing. And so thinking about where do people go after they're transitioning out of Sunflower Houses, but also just this is one small project, which again has been very successful, but thinking about increasing the availability of these types of housing in the first place to interrupt these cycles of incarceration and homelessness. And then also, we haven't, this presentation is not focused on this, but when we were talking about cycles of incarceration, Paula did mention Medicaid is a great example where once you're incarcerated, you do lose Medicaid, and then getting re-enrolled in Medicaid after reentry can be an arduous process. And so just thinking about petitioning New York State representatives to amend Medicaid in the state to reduce the healthcare coverage gap. And there are lots of opportunities to do this currently, for example, through 1115 waivers. And I will end there. Paul, I'm not sure if you'd like to add anything else.
Just because there's so many amazing people, it looks on this call. If you have ideas for additional funding sources for the sunflower houses beyond the county. We would love to hear them. I was thinking of Anissa earlier, maybe, who knows, HUD has some, there's a lot we might not know. All of you are housing experts here. And so we assume that, you have potential recommendations to us about how to create a permanent funding structure for sunflower. I will put my email in the chat. You can also, Liddy knows me well, so you can also just email Liddy if you don't mind, but you can email me directly or Liddy. But also I want to kind of just emphasize that really in Tompkins County, the population we're talking about that cycles in and out of jail repeatedly, which is kind of what we were looking to potentially reduce with the Sunflower Houses program, is a relatively small number of people. We're talking about 60 to 70 people. And we firmly believe that if you were to truly address the needs holistically of those folks, that a bunch of other things, right? Like it's this equity principle that when you address the needs and the vulnerabilities and the risks and the barriers of those most likely to kind of end up in these outcomes, that essentially you're improving the structure for everyone. And so if you have ideas or things that you'd like to tell us about things that we might not be aware of, we welcome your feedback, your comments. And certainly we will have another report at the end of 2024 that really includes the narratives and the testimonies of Sunflower Houses residents to kind of tell you in their own voices what difference the program has. So we'll stop and pause for questions.
Thanks. This is what I'm going to do. I miscalculated how long and dense and interesting your presentation was going to be. So we're going to hold questions for now. We're going to because we do have a second presenter who I think has a shorter but also informative presentation. So we're going to do the next presentation. You can, if you have thoughts, questions for Paula and Charlie that are like bubbling out of your heart and soul, pop them into the chat, just to make sure that even if we don't have time to answer them today, we can facilitate getting those questions answered for you. And then I am going to have Yamila from the city of Ithaca pop on. I saw you join at some point. Are you still here?
I'm here.
Oh,
Hi.
hello. Sorry, I lost you on my screen
Yeah.
of blank
A
faces.
lot of people.
There are some people joining us to talk about the Downtown Ithaca Plan. You can share your screen. We're gonna hear your presentation and are looking forward to it. Thank you.
Great. Well, thank you all for having me here. So what I wanted to do today is to give everybody kind of a little background on what we're doing here in the city for the downtown. So we're going to talk about the downtown plan, which is in process right now. So oh, here we go. There we go. So back in 2014, the city authored Plan Ithaca, which is our comprehensive plan for like the entire city. And it covers all sorts of topics. So everything from, economic development through housing, through public safety, through physical infrastructure and water resources and stormwater, everything. And so out of that process, we're mandated to kind of take that big plan and break it down to neighborhood on the neighborhood level. And so this year, we are looking at the downtown area to focus on. Now we started this process back in 2019. We had an advisory committee and we did a lot of like public outreach for it. And we were gathering that all together and getting ready to do the next step in early March of 2020, and everything kind of came to a stop. So what we're doing now is we're reconvening to look at the downtown. And so how do we define the downtown? First of all, is we have 3 different sections. It's the downtown core, the West State Street corridor, and the West End. And so I know for a lot of folks, when we think of downtown, we think of like near the Commons, but really when you look at our city, these 3 neighborhoods are the neighborhoods that hold the highest density and most of our commercial and services. So we wanted to put these all together because they all have similar things that they need to face. So we started, like I said, back in 2019, we stopped for the pandemic, and in November, we were able to reconvene an advisory committee and kind of check and see, because we did all this work back in 2019 and early 2020, and some of the things may not be as relevant anymore. So we wanted to get take a temperature of it and make sure it was still, the recommendations that we had come up with were still relevant, were still appropriate, and really address the issues that we're seeing now. So out of those 106 recommendations that we pulled together, 3 major themes emerged. Is that downtown really needs to look at livability. So that means housing, that's housing for all at all different price points. Streetscapes, we need to make sure that people can walk down the street and it's pleasant and there's good tree coverage and we have good green infrastructure with more rain events and more flooding. Making sure that the streets and our infrastructure can take up the rainwater is actually really important. Make sure that there are park scattering areas, access to goods and services within an easy walkable distance, and really reinforcing our arts and culture and building our resilience as a city. Connectivity is the second part that emerged as a major theme. So, we have this idea that we're going to be a net zero city. We're trying to reach that goal, but part of reaching that goal is making sure that more people can use public transit, more people can reach what they need to do within a walkable distance, and to make sure that that walking distance is safe and accessible, make sure there's bike connections, make sure we connect to our trails to get people out into nature. And of course, transit. The other big piece of that is transit, making sure that people can get into and out of downtown easily. The last piece that was a big theme was we need to be creative. We haven't faced a pandemic before. We haven't faced the housing crisis at this scale before. We've never really faced the kind of flooding that we're looking at. So in order to address these issues, we need to really think creatively and maybe think a little differently than we did before about our land use and how we do economic development and how we redevelop spaces and how we can support emerging tech and creative industries. So where we are right now is we've done that work to kind of pull these recommendations together, and it's time to vet them with the community. We want to make sure we got them right. So during the month of April and into early May, we will be reaching out to the community as a whole. Anybody who lives in downtown, who works in downtown, who accesses services in downtown, who just visits downtown once in a while. It's your downtown, because Ithaca downtown is not just one neighborhood. It actually serves the rest of the city and the rest of the county and even the region. So what we're doing for public outreach is you'll see us tabling in different areas of downtown. We're going to be having an open house at the library on May 2nd, which is not going to be like a standard, we all meet in the board room and have a presentation. We're actually going to be doing tabling throughout the library. So you can talk to different subject matter experts with who cover different areas of the downtown plan. You'll hear things about it on the radio. You'll see flyers around town. There'll be press releases out. And most importantly for this group is you each have such a really good network, far more than those of us who are sitting in City Hall have. So the more you can talk about it on your listservs or when you see it pop up on our social medias for the City of Ithaca or the Downtown Ithaca Alliance, making sure that you like or interact or forward that post to your groups. That would be super helpful. And what is it you're forwarding? It's an ask to do a survey. So we have a digital survey, really short. It should be under 5 minutes if you're just kind of clicking the buttons. Obviously, if you want to give like a comment, it can take longer than that. But it's a really short survey that has pinpointed some questions that are kind of key questions that we'd like to know about. At the end of that survey, there's an opportunity if you want to click yes and do the much longer version, there's an opportunity to do that as well. But we wanted to make it short and accessible to as many people as possible. There's a QR code for those who use that. There's a URL for those who use that. I will pop that into the chat as well, so you can just kind of click and get right into it. And there will be printed versions of the short survey available at the library. I actually got to meet with TCPL this morning, and so they're helping us do a lot of the outreach and making sure that we can reach people who don't always have access to the internet. And then we will be having an open house on May 2nd at the library. Again, I mentioned that was going to be dispersed tables throughout the library, both inside and outside, because there are some folks who don't feel comfortable going into the library, or some folks who are maybe more COVID cautious or immunocompromised who don't want to go where there's a big group of people. So we're going to have some tabling outside as well as throughout inside. And how you can help? Put in your newsletters, boost the signal, talk to folks in your community, encourage others to do the survey yourself. And that is it. So if you have any questions, I'm happy to hear what you have to say.
Thank you. Always good to have an opportunity to give feedback. So I thought it was really important that you be here and talk with these folks so that everybody knew that this opportunity existed. And also, like, just to be clear, I think we can share the opportunity to give feedback with the people that we're serving directly in our programs. People experiencing homelessness and housing instability are certainly included as members of the Downtown Ithaca community and need a voice. So those are my final thoughts there. I do see one hand, and we do have 8 minutes, so we can return to questions for Paula and Charlie. We can just raise hands if you have questions, and we'll get through as many of them about things as we can. I did see some chat action happening too, which is a great way to answer questions. I will start with Wes because I see their hand is raised, and then feel free to raise hands if you have questions.
Hey, yeah, I mean, mine is more of a comment slash a wondering, but I didn't hear any sort of like youth focused tabling or action happening. And I know that downtown is very youth. It's one of the only areas that they can go. And so I was just wondering if that was a part of the plan at all.
We will be, so being at the library is one of the ways that we can reach some of our youth. So one of the things we're talking, like I talked to some of the librarians this morning about how they engage folks coming downtown to use the library, because it's really one of the only free places you can go when you're like 14 and want to hang out.
That's great to me though, that it's not connecting to Black and brown youth.
So that's why I've reached out to Kayla. So we're going to be doing some work with Southside Community Center. So we'll table there. And then I'm also going to be working with Phoebe to do some tabling over on the West End. So we've done some homework to try to get out to more people as much as possible. But I absolutely, if you have a fantastic place or an opportunity or an event coming up where you're like, this would be a great place to have a table where we can reach our youth, I would love to come to join you. And the same goes for anybody else in this group. I'm here because I reached out to Liddy, and Liddy was great to be part of that advisory committee when we were looking at the recommendations. And I asked, should I come to one of your groups? So if you have a meeting, a group, a task force, a working group where having this kind of presentation and connection would be useful, we would be thrilled to come. So that's me fishing for invitations.
Great. I will try to grab the URL for the survey into the chat too. Thank you all for being here. Does anyone have, I think we have one quick, oh, go ahead, Martha.
Yeah, hi. Back to sunflower houses. So you had this significant gap for really the whole 3 years. Where did the balance come from? Did OAR just kind of eat that and pull it out of reserves? Also, what about URO? Were they paid in any way to provide services?
Yeah, no, so URO is really an organization that was specifically set up not to provide services, but to facilitate systemic change. So that means that they're the kind of person, they're the organization that tries to get these systemic pieces to happen through data-driven kind of, and collectively agreed upon kind of measures. But OAR is the one that provides the services, which is why they handed the project to OAR. OER definitely dipped into its reserves to a point of, like I said, danger of closing it down. And what really saved the program was Dave Sanders' ability to get night shift funding and opioid settlement funding to subsidize the operations of the program. So those are also not long-term permanent funding solutions, which is why we we recommended to the county legislature that this really becomes a kind of permanent operational budget. That doesn't mean that OER will stop looking for additional funding sources, but unfortunately, when you're constantly relying on temporary grants, it makes it really difficult to plan the longitudinal kind of view that the program was set up to do, which is to really support people for quite some time. There was a question from Eric who asked, what's the average length of stay? And the average length of stay is 142 days. Really, people could stay as little as 2 weeks, but also as much as a year at Sunflower houses. And that just indicates the variability of how long it takes people to get back on their feet once they have been in these repetitive cycles of chronic homelessness, incarceration, substance use disorders, and so on. And I really want to emphasize that there have been some incredible success cases from Sunflower. I'm talking about people who were living in their cars and were employed living in their cars, came into the Sunflower Houses program, got employment opportunities, took advantage of all the services, obtained permanent housing, were able to secure long-term sustainable employment, and will credit the program to absolutely being the determining factor to why they were able to achieve some of those things. And we're hoping that in the 2024 report, we'll include a lot more of those voices so that you can hear directly from the people.
Thank you.
I think our final words today will be from Ishkel.
Hi, thank you. Thank you for putting the survey up because I don't think I've actually looked at it before. I'm just a little confused though. I feel like a whole area of downtown is left out in the study as far as input, because when I look at this study, they want to hear about who lives in that area, who works in that area, who visits the area, but doesn't want to know about anything. There's no spot. I live downtown, but not in that area. But to me, it says I'm not included in this because I'm not a tourist. I don't think I visit. I live there. So it just looks like everybody who's not within that small area, their opinion is not like requested here. And I'm just a little confused how that's going to work out.
Okay, so we were thinking about anybody. Visit was the kind of catch-all term that we were using for anybody who doesn't live or work downtown but goes downtown. So
Right.
what I could maybe do
So-
is maybe rephrase that so that it feels more inclusive.
Well, I live downtown, but I do not live in the downtown study area. So what happens downtown, one street over from me, which is in the study area, affects me. What is happening? Yeah. And the wording here, a visit, is not what I consider I do and not what any of my neighbors consider. Like, we live there. We are there every day. So I just feel like this is not considering our input. I am not a visitor. I live downtown. And I don't think anybody else would feel that same way either that lives next to me, 1 block over from a study area.
Yeah.
So
Well,
I'm just wondering how that would work out.
Then I would probably, if I know you don't feel like a visitor, but you're somebody who walks into the downtown area from somewhere else, even if it's 1 block away. And we all know that, like, unfortunately, we don't have hard borders here. Everything is fuzzy. So like when we did the South Side plan, people who are 1 block or 2 block off the South Side still walk through the South Side and use the South Side, but they're not really, they don't live there, they don't work there. So it's always a little bit fuzzy. So we have to draw the line somewhere when it comes to making these maps.
Right.
But it's not a
wording-
hard
Right. And I agree, like, about the line. That's not, I'm saying there's no question that says I live outside the downtown study area downtown. Because how that affects me,
Mhm.
living outside the downtown study area downtown is going to be different from somebody who visits downtown. That's all I'm
Okay.
saying.
Yeah, I think what we're not showing here is that, those other areas that are even just a block off are put into a different neighborhood's definition.
Okay.
Right.
So really, so I don't need to really answer this one because there's different surveys about different areas of downtown.
Well, there was a south side plan. So if you're a block off of that area towards the south, you would have answered the south side plan as a resident of the south side area. There's going to be the Fall Creek area. There's going to be north side. There's going to be a few different things. So we are doing these one at a time. So it takes
Okay.
about a year to develop a neighborhood
Okay.
plan. So
Okay.
we did south side plan, we did the waterfront plan, now we're doing the downtown plan. So if there's going to be another neighborhood plan, it's not going to come this year.
Okay.
But
Okay.
we still
Thanks.
want your input because you're somebody who uses that space. And the thing is, we want everybody to use the survey. Just because you don't live there doesn't mean you don't use the space.
Right. Okay. Thank you
Uh,
for answering.
Thank you. Martha had a good language suggestion in the chat there. We're done. It's 11, but
Yeah.
please don't leave just yet because we have one final announcement from Simone Gatson as you exit the room. So thank you all for being here today. Turn it over to Simone.
Yeah, I just wanted to highlight a couple of opportunities for folks to engage with the COC outside of Homeless and Housing Task Force, because I see a lot of faces that I've seen in this space, but not necessarily in some of our other spaces, and I wanted to welcome you there. So next Tuesday at 1:30, we're having a meeting of our Unsheltered Homelessness Committee, and we're inviting Nicholas Coulter from Person-Centered Housing Options in Rochester to talk about the development of a sanctioned encampment by their organization in partnership with Land Trust and the city and the county, and he's going to talk about how all of that works. But we're going to be meeting next Tuesday at 1:30 to discuss that. So if you weren't on my email about that, but that sounds like something you are interested in, please send me an email. I will put my email in the chat, and we'd be happy to see you there. Otherwise, if you are a service provider, we have our Services Second Committee that's going to be meeting Wednesday the 10th at 3 p.m., which is a lot of networking and just kind of getting to know serving and housing providers in the area to build more robust services for a housing first model in Ithaca. So if you are interested in that instead, or both, please shoot me an email and I'd be happy to have you there. Otherwise, there have been some folks reaching out to me about coordinated entry, wanting to know more about it, wanting to get training. I am open to that. And so please do send me an email if you are interested in learning about coordinated entry, if you are interested in having your organization complete coordinated entry intakes, or just want to know a little bit more about how to plug into the process. Just wanted to kind of open those up as opportunities for you to engage with the COC moving forward. So that's all. Thanks.
Great. Thank you so much. It stopped raining and the